So hi, everyone. I'm John Schmidt, Senior Vice President of the Value-Based Care Exhibit Hall. And I want to welcome you to this week's Value-Based Care Exhibit Hall Flash interview. And this week, our guest is Eric Weaver. Eric's the Executive Director of the Institute for Advancing Health Value. Some of you may have known it as the ACLC, the Accountable Care Learning Collaborative. It was rebranded a few months ago. And just as an introductory note, I just wanted to say the Institute, in my opinion, is one of the best resources available if you want to take a deeper dive into the world of value-based care. So Eric's going to tell us more about it. So that said, welcome, Eric. I wonder if you could share with us for just a few minutes the mission of the Institute and some of the resources that are available there.
Well, it's great to be with you today, John, and it's an honor to be able to speak to the Value-Based Care Exhibit Hall community. It definitely does take a village to make value-based care work, and that's really the spirit by which we approach our service to industry. So the Institute for Advancing Health Value, we're a nonprofit organization. We were founded 7 years ago by former HHS Secretary Michael Levitt and Dr. Mark McClellan, former CMS administrator for the Bush administration. And they had come out of the public sector thinking, we got to get industry together. We need a environment for ideation and peer learning and really think about how do we accelerate industry readiness for success and value. So that's really kind of the genesis of, how we came to be as the Accountable Care Learning Collaborative. And we just recently rebranded to the Institute for Advancing Health Value, which signifies our increased support and collaboration for the value movement and supporting industry through education, collaboration, and workforce development. At our core, what we do, we're a learning collaborative. We have members that are comprised of every type of organization in the value ecosystem, from health systems, ACOs, CINs, post-acute care groups. We have industry partners which provide solutions into the value landscape, which include tech companies and pharma. We have associations, universities, but really what we're about is providing an environment for learning. We put out important research and intelligence on all facets of the value economy. We release case studies and host peer learning sessions around those case studies. And then we're also here to support the reskilling and upskilling for the workforce for success and value. And we have educational products. We took the legacy assets of the ACLC. We've convened subject matter experts, and we worked with Western Governors University to build some outstanding curriculum to support workforce development and population health equity and value-based care. So, John, that's a little bit about what we do and how we serve industry.
Oh, that's great, Eric. And the podcast, for example, that you guys offer through the Institute, incredibly valuable. Had the chance to listen to a number of those, and just again, excellent output. So thanks for making the contribution that you do to the value-based care world. It's obviously where healthcare is going, and needs all the help it can get. So,
well, we're here to serve. Thank you, John. And that podcast, Race to Value, if anyone wants to check it out, it's a weekly podcast, and we appreciate you being a listener and all of those out there that are part of our audience there. And it's been a pleasure being with you today, John.
Well, thanks, Eric. Same with you, and delighted to have had this opportunity to learn more about it. And so for additional information, folks, please feel free to visit the Institute's exhibit booth in the Value-Based Care Exhibit Hall. That's what it looks like when you get there. And thanks again to everyone for joining us today, and a special thanks to you, Eric, as well. So hope everyone continues to stay safe and well. Goodbye now.